Closer. My name is Ben Margolis, Dr. Margolis. I'm a neurologist and psychiatrist, and I provide behavioral care for adults with intellectual and developmental disabilities in the Hudson Valley in New York State. And I'm working with Access Supports for Living, which is a developmental disability services organization that has a community mental health clinic here in Orange County, New York, where we are providing specialty care for adults with IDD. So COVID has brought out the best in the community that I serve, and the challenges have, of course, been unimaginable. The losses have been unimaginable, and the bravery that I've seen among families and caregivers has been unbelievable. So it started, we were very early in the epidemic because of our proximity to New York City. So our experience mirrored New York's. Orange County is a place where a lot of commuters back and forth from New York City and Manhattan live, along with Westchester County. So we saw our spike mirror that of the initial biggest outbreak after the West Coast, right around the beginning of March. And it was at this time that it wasn't known how airborne it necessarily was. And so when it hit hard, and it hit all at once. So our clinicians were impacted, fortunately, to a limited degree. We had to close our clinics and within a week go completely remote. As far as the staff, our therapists were the ones, and our brave front staff seemed to be the ones who were sick the most. Of course, the ones who interact most with the public. And it seems that the COVID impact has required the most from and been the most impactful for those who are most vulnerable. And that doesn't just include the individuals that we serve, but that includes the heroic caregivers that have been so dedicated to them. Physicians, and we take risks, and we are compensated better than people who are taking even greater risks for no hazard pay at first, and with unclear guidelines at first, and that they stepped up and selflessly put themselves at risk, protecting themselves from their families, doing the same thing that our frontline workers were doing, but without any of the recognition, and without, in a lot of cases, the resources that our frontline workers and frontline healthcare providers gave, was just absolutely spectacular. So let me give some examples. So the organization that I work for really stepped up very quickly in heroic fashion. So immediately, with the start of the pandemic in early March, we had the CEO of our organization driving to auto body shops himself to pick up Tyvek suits, or to pick up whatever PPE we could source to be able to give to DSPs and house managers who needed them to care for our individuals. We had staff who would not go home to be with their loved ones for fear of getting their loved ones sick, and would quarantine with individuals. The same way you heard stories of nurses, and the same way you heard stories of ER docs who would sleep in their cars, or get a hotel room, or sleep in the garage because they were afraid of exposing their families, but who were so nationally supported and who were thanked constantly and had informal parades every day at 7 p.m. In New York City. None of our guys had that, even though they deserve it. And they did it with less reward and with less compensation than a lot of the frontline workers that we celebrated. Fortunately, our organization did recognize those people as funding became available, and they were supported internally. But among the public, that's been I shouldn't say silent. Among the general public, I don't think first-line caregivers and direct support staff have been recognized in that way, and they get sick, and they've gotten sick. Among our clinicians and our DSPs, we have fortunately had few hospitalizations, and in our organization, we internally only had one death among the staff. But among the people I work with and among the various agencies that I provide care for, it's been much more. So then they've continued to do that, and they've continued to come back to work after they've recovered, and they didn't say anything about it. I didn't hear any complaints. I heard fear and confusion, but never a complaint. And I think maybe that's because of the position I'm in, but I think they bore the burnout differently. And I really just want to take some time to point out the heroic work of the caregiving organizations. So what about the individuals themselves? The individuals themselves have been, when they get sick with COVID, they've been devastated. And it's been so absolutely unpredictable. I have a patient who's quite elderly with Parkinson's and mild IDD and bipolar disorder. And when he got sick, he was very minimally symptomatic, just a little bit of a cough, and he did great and didn't need to go to the hospital. And then we've got other individuals who have been, with minimal risk other than their intellectual disability that we're aware of, that have been have either died or been very, very sick otherwise. And the recovery has not been as smooth for these individuals as I would have hoped. It's not a 3-week course and recover. You're seeing special homes having to be set up, medical discharge homes in our area, to be able to provide the kind of ongoing services for our patients who are no longer ambulatory and whose respiratory status is still compromised and who can't come off oxygen after COVID. I specialize in mental health care, and the impacts from all angles, from lack of resources to services, from changes in staffing, from not being able to visit with relatives, from going back and forth into quarantine, has been really hard for a lot of people to cope with, a lot of the individuals that we serve. And with that, we've seen sort of a slow burn of challenges. At the very beginning, the individuals we serve stepped up in a lot of ways as well. And the sense of emergency was initially protective, with this flood of activity and teamwork to be able to adapt. But then month 2 came around, and month 3, month 5, month 6, I should say. And now we're at a point where everyone is very sick of it. And the stress and the anxiety has come over into depression. Maladaptive behaviors, old behaviors are returning, which are totally understandable. And the stress among staff and fatigue has only mounted. The stress among staff who have to figure out how to take care of the individuals they serve at the same time as take care of their children who are now remotely being educated. So it's an unbelievable and ongoing challenge, and the rest of the country is now experiencing the same thing to a great degree that we experienced over all this time. And as things quieted and opened up over the summer and fall, it was a wonderful and welcome respite. But now, as I speak, it's November 20th, 2020, and the smolder has become an ongoing fire again, and it's returning in New Jersey, and fortunately so far to a lesser degree in New York, but we're approaching Thanksgiving, and I'm so hopeful that we, now that we're aware of what precautions to take and are taking adequate precautions, that we don't get further out of control. But until we have a vaccine, the struggle continues. And if I could take 1 second just to dovetail what I was saying before with the heroism of the caregivers that we work with, I cannot stress enough that these are the people who need their vaccines first, along with the individuals we serve. Let's put them at the front of the line, and can only offer respect and great thanks for the people that we serve, for their patience and their bravery along with us, and for the unbelievable bravery of the caregiving community, of the DSPs, the support professionals, the house managers, the nurses on the field, all of the clinicians who represent the best of humanity and have demonstrated that so clearly through this crisis.
Wonderful. That is terrific.